When you are Burundian, particularly growing in rural area of Burundi, you really don't need to be taught how important healthcare is. You live it, you smell it. You live in conditions where it seems like death is more common than life. I was born in rural Burundi. When I went to school, my first day of class, we had a lot of children packed in a classroom like sardines. By the end of the school year, the classroom was half empty because so many children died from totally preventable diseases. Today, I do not have a friend of childhood alive. Every time someone was being buried next to our school, people would cry family members. And then the teachers would tell us, kneel down and let's pray. That was the medicine. I would ask myself, if I could make it, how could I change these conditions? The war started in Burundi. I ended up in the United States and had $200 US, didn't speak English, and I was on my own. So that's how I ended up being homeless in Central Park. I felt that my pride, my dignity had been destroyed, and I was half alive. I was no longer the person I used to be.
I could see he was so thin, and I could just imagine what he'd been through. I'd seen terrible things on television. I just wanted him to be able to start to breathe deeply and know that he was cared about.
Sharon showed me humanity. She showed me kindness, compassion, that despite everything that had been going on in my life, there were still people out there who cared, and that I should not give up hope in my dream. I went to Columbia University as an undergrad and moved to Boston, where I attended a school of public health and Dartmouth Medical School. In 2005, I went back to Burundi. I saw for the first time after 11 years, patients dying in horrifying conditions. I knew that Burundi had suffered. I had no idea that patients were dying at home the way they were dying. In hospitals, people were there to watch themselves die, not to be treated. And the conditions they were dying in were so dehumanizing that I couldn't remove these images from my head. I visited all public hospitals in Burundi. Every single hospital I saw was worse than the previous one. And yet I had hoped that maybe the next one would be better. There can't be anything worse than this. But I was wrong. And I got a big picture of what being sick in Burundi meant. I needed to do something about it. That was the beginning of Village Health Works. The vision was to change the healthcare system, to bring decency where it had been lost, to treat patients in a dignified environment, make sure that no mother dies in childbirth again.
I think what drives Deo and what drives all of my clinical colleagues, everybody, is a belief that we can do better, that's not the way things need to be, and moreover, that actually the solutions for this are eminently available, they're doable. Yes, they take will, yes, they take resources, but we can change the story.
The first step was to make sure that every single one in the community who could be available could actually make it happen, participate. Don't sit down and wait for someone to do something for you. And that community was the first greatest philanthropists to rebuilding their own community. They donated the land, they built the road. Every single Friday, they would come by hundreds, carrying bricks on their heads, digging stones. They were the transportation system. They were the trucks. They were the one who were feeding us. They were the one with the ropes going around. We didn't have any surveyor. So they really came together to build Village Health Works. We're talking about former enemies who had spent over a decade running away from each other. Now they are friends, they are collaborators. They know what they can do to protect their communities from being destroyed, but also to make it flourish, be a community, a peaceful community, a community that has hope. The trauma of war they were carrying all the time started really healing because they were having constructive conversations. They were not afraid anymore of each other. We started with the health, and every program we started brought a new program. We had a lot of children who came to our clinic suffering from malnutrition. So they needed to eat healthy food. So we introduced food security program. We just opened a boarding school with the idea of creating an education based on critical thinking so that we can have future leaders who are able to think. It's this really beautiful, holistic approach that is embedded in the community and through Village Health Works. It's really a place of hope and growth and peace. We've been a primary care health center. Now we are moving to becoming a teaching hospital. We call it the Women's Health Pavilion and the Kigutu Hospital. It's a 150-bed hospital, 85,000 square feet. It's going to offer pediatric care, surgery, primary care, but also help healthcare professionals, medical students in the country to come and learn and improve the skills they have and they need to take care of patients.
What is unique about this place is that you can see single private delivery rooms for each patient. So this whole block here is basically from that moment, from there onwards, for training and research. The idea is a humane hospital for human beings. People are dying right now in childbirth. Many people die here for, well, no good reason, really. Preventable deaths. Building something like this will have two effects. It will make a contribution, but it also highlights the scale of the problem. And hopefully it will also inspire other people to do similar things.
We started with a little clinic, and now we are evolving to becoming a center of excellence. It's community building, it's peace building, it's providing healthcare system, the quality of education. So it's life and livelihood. So it's really something that needs to continue to grow and shine hope, not just in that community, but beyond that, and show that indeed where there's health, there's hope.